Oh, perché io te poco ti aiuta? Cacciare.
Hello. I'm just setting up some things here. I guess we can wait some minutes for starting the discussion. Okay?
Yes, okay.
Everyone is listening?
Yeah, are you listening to me?
Yes,
Okay.
listening to you, Bianca. Maybe 3 minutes.
Okay.
Okay?
Hi, Amber.
Hello, I finally made it.
Yay!
Okay, so uh, I guess we can start with our discussion. Are you fine?
Yes.
I'm so glad to be here today coordinating this Row Cafe. It's such an honor for me. I was in the last Row Cafe in India, and it was such a great experience. I coordinated the Twitter there, but it was so nice to see everyone from all around the world in a room discussing about Row, talking about challenges, and participating on Twitter, even people that were not there. I felt so good, and now I just want to continue this discussion. And um, today we're going to talk about telehealth. Our main topic is telehealth. I hope you guys uh, are really excited about this. And first, I guess we should introduce ourselves. What do you think?
Yes.
I can start.
Okay.
My name is Andrissa. I'm from Brazil. Um, I am a medical student, and I live in the south part of Brazil now. And nowadays, I'm working in Rural Seed Network, producing some content on social media, and also I'm involved on the rural animated videos. Um, and now I got this responsibility to represent my ad. And yes, it that's all. Joseph or Bianca or Galbert?
Yeah, me?
Okay.
Yeah, my name is Joseph Vidal. I'm from Catalonia. I'm near Barcelona, and well, I'm here because I'm doing a PhD on telemedicine.
Wow.
So of course I couldn't miss this Rock Cafe.
Yes. Nice.
And yeah, I'm nearly finishing now. So it's interesting because I am evaluating a telemedicine program that we have developed in our region, and of course, I'm obtaining some good results, and I'm planning to help implement telemedicine programs across Catalonia if possible, and always starting in primary care.
Nice.
And yeah, just we will talk, I suppose, later
Yes.
on. Telemedicine is very useful, especially as you know, in rural areas. So it's very convenient to have this rural cafe today.
Yes. Okay, I can introduce myself now.
Okay, you can. Yeah.
So I am Bianca. I'm from the south of Brazil as well. It has been a long time that I could not be able to be present at the Rural Café. I am in my final year from medicine, and it is really exciting, but it's really exhausting. And time is running so fast, and I have to be at so many times at the same time. So I was not able to be here more present. So I'm really, really happy to be here now. I had a really nice experience about telehealth in one of the internships that I have participated, and it was actually in rural area. So definitely this really special tool that we can use. But I will talk a little bit more later. Thank you.
Okay.
Hi,
Hi.
are you hear me? Are you hear me?
Yes.
Yeah. This is Govind from Sri Lanka. So you may know me, Joseph. Hi, Joseph. I'm from Sri Lanka as a family physician. I'm doing my postgraduate in family medicine currently in the first year. As well, I'm doing the visiting lecture at the Faculty of Medicine, Community Medicine, and Family Medicine department. So in there, as you all know, I have done actually we missed the Joseph, but we have done a workshop there. There's two workshop about the telemedicine in India as well. So mainly we talk about our experience in our region. So we'll then hereafter we'll just talk about. So actually this is very good because as we are isolated from the main urban or even town, so maybe the telemedicine or telehealth would be some sort of relief for healthcare as well. So we can use it in the useful way. We'll talk about. Okay, thank you.
Okay.
Hi, Ampar. Where are you? Are you here? Okay.
Hello, sorry, my computer is not playing with me today, so everything's freezing. Anyway, so my name is Amber Wheatley. I am a young doctor originally from the Virgin Islands, but I'm currently working in Southwest Wales in a semi-rural area. I'm interested in the topic of telehealth as well as in the Virgin Islands. Basic technology doesn't always work. As you can see, my internet is terrible. So I'm interested to hear what other people from the rural areas have done, and hopefully we can learn something that I can use here.
Andressa, you are in the mute.
Okay. I will ask when we are not talking, we can mute the microphone and also unmute when we are supposed to talk because there is an echo, but it's fine. Okay. So now, Dr. Roger, can you introduce yourself?
Yes, am I off mute? Can you hear me? Can you hear? Yes, you can. Okay, good. Sorry, I had a lot of difficulty working out how to join. I haven't been able to join other than I was with the Rural Cafe in India, but I haven't been able to join since it's on YouTube. And anyway, I'm glad you can hear and see me now. My name is Roger Strasser. My background is as a rural family doctor in Australia, and since 2002, I've been in Canada, where I'm the Dean and the CEO of the Northern Ontario School of Medicine. And talking about the topic, telehealth, telemedicine has been a major focus for me for well over 2 decades. And in fact, just 2 decades ago, I was the first chair of the Working Party in Rural Practice of Wonka, and we put out a policy, a Wonka rural policy, on the use of information technology, making information technology, using information technology to enhance rural healthcare. And the issues in that policy haven't really changed. Some of the platforms of information technology have changed quite dramatically, but the basic issues, I think, are still the same.
Nice. And actually, we are keen to know more about the information technologies policies from Wonka. I guess it's supposed to publish a document about it, but I don't know if it is available for now. And then you can explain more to us after, Dr. Roger. So, do you want to speak?
You asking me to speak some more?
What? Can you repeat?
Yeah. So I have not seen the latest draft policy on digital health. I think, unfortunately, the timing of this Rural Cafe doesn't work for Ewan McPhee, who's taken the lead with writing this. It's around midnight where he is in Australia. So the original policy on using information technology to improve rural healthcare came out of discussions at the very first Rural Health World Conference in China in 1996, and then it took a year or two to polish up the actual document. The central message was that information technology has great potential to support, enhance, improve healthcare in rural and remote community settings. But unfortunately, often technological enthusiasts in the big cities promote technology communication technology as a mechanism to to deliver healthcare, and in some ways without having doctors and nurses and other healthcare providers on the ground in rural communities. And certainly at that time in the late 1990s, and again now in the 20 years later, we have this situation where technological enthusiasts are promoting to health authorities and policymakers, to governments, this idea that rather than focusing on education, training, recruitment, retention of a health workforce in remote rural communities, this can all be solved by the use of communication, digital technology. It wasn't true 20 years ago, and it's still not true. The central message of the policy was and is that there is great potential for communication technology to enhance quality and effectiveness of care in rural and remote communities, but how the technology is used, when and if the technology is used, needs to be in the hands of the local people in the rural and remote communities. So the healthcare providers, the community members themselves, to actually to become familiar with the potential of the technology and decide how to use it, so that the role for specialists and subspecialists in the larger population centres is to support the local providers of care as the frontline providers of care. Of course, the other big advantage of communication technology is access to information and educational resources, and that has made a huge difference. There's no doubt about that. If you have access to the internet and you have a digital library service, then you have access to educational resources and information, the same as if you're in the big city, like in a teaching hospital environment. So I think that is something that's really a huge advance compared to 20 years ago. But the principle that it's people and the healthcare providers in the rural communities should be determining if, how, and when to use the technology to enhance the care in those communities. That's really the key central message of the policy, and that's really where we should be focusing.
Yes, so nice to know about this. Do any of you want to continue the discussion? I can elaborate your question. Are you listening? Okay. 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 There's a noise in my headphone. Are you hearing this noise? Oh, that's it. Let me just.
I think that, Joseph, there is a problem with your mic.
Yeah, must be.
Okay, maybe we can start a little bit more talking about, for you, what is the meaning of telehealth? Because now it is clear the importance of communication and virtual health services. But what do you understand about telehealth? Maybe from country to country, there are different meanings. I don't know. So if you want to talk more about, maybe Amber or Gabby.
Yeah, sure, I can talk about it from the perspective of Wales. So we have an advisory on the use of telehealth in medicine. Unfortunately, a lot of the areas in Wales don't have very good telephone communication. So it makes it difficult to try and branch out using other forms of communication. But for certain areas, they have used things like Skype clinics to save patients having to travel for quite a long distance for a 10-minute appointment. You can use a more cost-effective method of having a Skype clinic, so it saves travel, and then the doctor is able to see more patients, and there's increased compliance and things like that. Um, and of course, with looking at medical education, every health board has a number of hospitals within it. So the health board that I'm in, for example, has 3 hospitals. A lot of our training for junior doctors is video conferencing. So if there's a teacher in one site, the lesson is video conferenced to the other 2 hospitals, and so you rotate who gets the live teaching and who gets the video conferencing. But it means that nobody misses out on anything. And we do similar things for meetings across the health board to try and get people's feedback.
Um, I may add some. I would like to say that recently we are from the Brazilian Family Medicine Society. We wrote a book, and it was a really nice experience for me because it was my first time writing a chapter. And we wrote about communication technologies, communication and information technologies. And we wrote also about telehealth. And it was really nice for me to write about it because I had to study about it and I could discover so many things about it. The main topics that we were talking about it in the chapter are the both that Roger and Amber mentioned. The topic of the Paula, can you mute your phone? Yeah, thank you.
Yeah.
Okay. And the fact that the telehealth can help the doctors also to help to attend the patients, and also about the education, right? But what is I think that we should mention about our reality here in Brazil, especially, is that when we started writing that chapter of the book, we had a really nice telehealth all around the country. The main base was here in my state, Rio Grande do Sul, but we had pieces of it in everywhere of the country, and all these points of telehealth in Brazil, they had financial support. And here in Brazil, we have a political situation that is changing our reality. And when we were ending the writing of that chapter, the reality was already different. And all the other points of telehealth in Brazil that had previously financial support had not, they do not have anymore. Only the one here in my state. So it's really sad to see how political situation can intervene you, but it's undiscussable the how this tool can be amazing. So, but it's really sad to see how the political situation can change it. So, just a notice about our country and our reality.
Yes, and actually, Bianca, as she was saying, now this week they reactivated the program for all the states of the country. Yeah. Thank God, because it was they just cut off from the other states, but now they are reactivating to the other states. The good news for us, but it was really really bad the from times before. I guess it was been a year since they deactivated the telehealth program. Yeah.
Yeah, probably because we ended writing the book. I think it was last February. Yeah, maybe it is 1 year also. Oh, wow, so fast. Yeah.
I would like to invite Joseph to, to talk about the telehealth in your country. And then Dr. Joseph. Oh, we're having some issues with the microphone.
Hello? Hello?
Hello, we are listening. You can talk.
Okay. Yeah, I think, well, first we should distinguish which type of telemedicine are we talking about, because there are several different types. Like the first one is the one we use is a synchronous telemedicine. It's not real-time telemedicine. And we use it for teledermatology, for instance, that we take a picture and then we load this picture to the clinical notes, and then the dermatologist in the hospital reviews the picture and gives us an answer. This is probably the cheapest type of telemedicine, very useful and very extended. And then there's a more expensive one, which is a kind of video conferencing or synchronous telemedicine. And then there is another one, which is kind of the patient's monitoring, which is very interesting as well, but this is also quite expensive. So I think, as I say, we can distinguish these three types of telemedicine. And probably when we talk about telemedicine, we should say which kind of telemedicine are we interested in, because probably in rural areas we could use the three types of telemedicine, but just the two of them, they are quite expensive.
Yes. Maybe Dr. Roger, you.
Yes, I just to follow up on that comment, I think it is important to be clear about the different, make the distinctions between the different ways in which information technology may be used. So the example of asynchronous connection, the store and forward approach, is particularly useful where you have limited connectivity, low bandwidth, and examples. The example was given about dermatology taking a digital photograph and then sending the picture. It doesn't matter how long it takes to get to the other end, with then the case description, and then wait for the response from the dermatologist. Again, it might take a day or two, but that's a very useful, and clearly there are lots of other examples in seeking advice and assistance from specialists that using that asynchronous or store and forward kind of approach to telehealth. The real-time approach does require considerable bandwidth in order to be able to transfer video, data, pictures, and voice at the same time. And these days, that's generally using the internet rather than sort of dedicated fiber optic or through dedicated fiber optic connections. And in many parts of the world, of course, the mobile phone network or cell phone network has the capacity for bandwidth and data transfer has improved. There's a third category. So there used to be a distinction between telemedicine and informatics. So the third category is transferring health information, so health informatics, using information technology and the electronic health record or electronic medical record and sharing information that way is another important and potentially valuable, particularly in remote and rural areas where you have clinics that are distributed over a large area, to have a common record that's electronic and then is accessible from different points is important. I think the next point we really need to emphasize about telemedicine, telehealth, health informatics, the use of information technology to enhance healthcare is that as soon as you start discussing specific clinical cases, individual patients, then there are critical issues about confidentiality and privacy of the information that's transferred. So that then requires assurance of the security of the information, the data that's being transferred. And again, in the last 20 years, there's been much improvement in the technology and the ability for encryption of data, and then and so that interception in between or being received by an unintended party is less likely to happen, but still an issue that needs to be carefully considered. And I would say that generally that is considered when we are talking about healthcare delivery and health services and clinical settings are very focused on that, hospitals in particular. Sometimes, though, when we're talking more about education, whether it's medical students, whether it's trainees or residents, or whether it's doctors and other health workforce in practice, for continuing education or updating, as soon as there's a discussion of individual patients or cases, then the same concern applies in terms of privacy and confidentiality, and that's something that's important really to be understood, and from very early on for medical students to learn about and to ensure that they're very, very careful. It's really a part of the responsibility, professional responsibility of any doctor and any health care provider.
Yes, it's a really good topic that you said. We have to know those differences. Maybe Dr. Gobbett, do you want to comment? Yeah.
Yeah, so we have talked about actually the Rajat has said about from the beginning and now what's going on, and yes, you have seen our policy maybe from the Roger has said about they have from the China now Joseph and McPhee has both has modified and added more things. I think it will be released very soon. Joseph, we have really missed you in the India, so otherwise we would have discussed more about that. Yeah, in our country in Sri Lanka, is a small island country. Yeah, from my place, we do lot of services through the telehealth. In fact, the telehealth we can see at the e-health or m-health like that. So we do even video conference, video consultation through the mobile app. Actually, this is a part of the private app. So currently, I'm just doing my postgraduate. So most of the time I away from my own practice. So in the practice, I just come to the town or city. So maybe my patient's missing. So they can catch me. So if I am free with the mobile app, so I can video consultation or audio both. As well, we have the SMS services from the local rural center. They can e-channeling through the even web-based as well through the SMS system. Like that we can do. As Roger said, we can. So now I'm visiting the lecture as well. So sometimes normally I try to go at 5 day and do lectures. But if I am unable to go, so I arrange to the Skype discussion and all with the medical students and all. So we can do even so as we are not available in our present our place. So even though we are away from that, we can do a lot of. But even though it won't be the replacement for the direct contact, but even though we can do more lot. I think also maybe we are about to publish the policy. So it has it good even. So we had a workshop as well, even and Joe both has done a workshop as well. So explained about what are the key things we added from the beginning. So if it is good, so we can do a lot of things. Any comment? Thank you.
Let me ask Paola to introduce herself. I almost forgot it. You can introduce yourself and then you can talk some. What do you think about telehealth or this?
Talk some, what do you think about telehealth? Estão me escutando? What do you think about tá bom? Paola, try to take off your phone. I can use only the computer mix. Don't connect it. Tá bom? Paola, try to take off your phone. Use only the computer mix. Não, eu já tirei, ó. Uhum. Vocês estão me escutando bem ou não? Yes, there is a sound, but it's okay. You can talk. We can listen to you. Ah, tá. Então, oh, in English. Hello. There is a sound, but it's okay. Just a second. Martina, vai pra lá que eu vou falar. So, hello. Good morning. Good morning. So, I am Paola. I'm a student from Brazil. And what I think about telemedicine is that's good, that we can use to help us, like family doctors. I lost a part of the conversation, but here in our state, we have a very nice project that is the Telehealth, Telesaúde, and it helps a lot the physicians that works with family medicine in our primary care here. So I think it's very useful, very important, and we should have more money from the government to help this system. It's okay? This project here in Brazil, it was supposed to be working in all Brazil, but they didn't have enough money from the government, and now it's just working during the morning and just here in the south. This is sad because this kind of system is very useful, but just a second.
Paola.
Mommy!
I just need to say hello.
video conference, so it's okay. Family medicine, family participating.
That's it. I think this project, this telesaúde, it's very interesting because they have very good specialists helping.
Paola, I was before you come, I was just saying that they are going to start again
I can hear
the telehealth project in all the states of Brazil. Could you listen? You can just use your microphone.
Peraí, que a mãe vai levar pro lá com a mãe.
So, in Brazil, we are now having again the project, and so we are going to start again. This news is so new that not everyone knows. I just knew about it on Facebook page, but the Ministry of Health have shared this news. Okay. So I just wanted to know from you, what are the main challenges of doing telehealth in your country, in your place? Because here in Brazil, as Bianca and Paola have said, we are some financial problems maybe, or actually there are people that want to join a telehealth project in Brazil to be a consultor. They are doing they are doing they are recruiting people to work on these areas, but there are not so many people to do this, capacitated people to do this. And what about your countries? What do you think?
Yes, may I talk? It is one thing that it worries me about telemedicine in rural areas, and it's the fact that I don't like that telemedicine is used as an excuse not to give the full service that the full healthcare service that the population deserves. So, telemedicine, telehealth shouldn't be a mean just to save money and to avoid putting resources in rural areas. It should be a help, but not a substitute of the proper provision of health. So this is one of my main worries. Telemedicine is a help, but it shouldn't be a substitute of normal medical care.
Any other comment? Okay, you can talk, Dr. Roger.
Yes, I certainly agree with that comment that's been made, this idea that providing telehealth services is a substitute for on-the-ground, well-trained care providers, doctors and other members of the health workforce. And I mentioned that one before. I think the other issue that's been mentioned already is the practical issue of the actual connectivity, like having internet or bandwidth to make the communication effective and productive. So it's a practical infrastructure issue. I would say that then another major challenge is a mindset issue. That is the minds of the specialists and other service providers in the cities, in the population centres, starts with their assumption that anything that happens outside the big cities is second class or a lesser standard, so that so far as they're interested and willing to support rural healthcare, they see themselves, they start with a rather paternalistic or patronising sort of mindset in their interactions with the care providers, and so that's a big challenge. That it's hard. It's not immediately visible because it's in the minds of the whether you're talking about the specialist service providers or the administrators and the policymakers. So it's really for all of us to demonstrate and to maintain an absolute commitment to high quality healthcare and evidence-based care wherever we are in remote rural settings, and then to earn the respect and the trust of the colleagues that we have in the cities, in the larger population centres. That then, in addition to the mindset, maybe an extension of the mindset issue is that often the equipment, the capacity at the city end to implement telemedicine, particularly real time, so video conferencing or web-based video connecting, either may not exist or is not seen as particularly important or useful by the administrators and the specialists and the others that I said, so that they don't have the equipment. This is now more than 20 years ago when I was with Monash University School of Rural Health. We actually donated a telephone, a teleconference, a conference call set to the faculty office in the city, because they didn't see it as important for them to have the capacity to meet by teleconference. They expected everyone to come to their place for a meeting. We've of course left that a long way behind, but the underlying mindset and the lack of embracing the use of information technology communications, and therefore seeing the role of in the city as supporting the local care providers, and whether they're some form of community health worker and doctors and nurses as the providers of all care in that setting. Because then the other barrier is if there is some kind of telemedicine, telehealth service where specialists connect with patients, if the local care providers are left out of that, then you get difficulties in communication and fragmentation of care as well. So I've listed a number of practical barriers or challenges, and just to remind you, the actual infrastructure, and actually I didn't mention one that's important on the ground in the rural communities. Not only having the infrastructure, whether it's video cameras and microphones and equipment with the capacity for telemedicine. It's one thing to have that equipment. Is another thing to know how to use it and how to maintain it. And so there certainly historically have been examples of equipment being sent to rural health centres, and it sits there in a box gathering dust because people don't even unpack it because they don't know how to use it, or maybe they do unpack it and they try to use it and it works for a while, then it breaks down and there's no one there who knows how to fix it or to keep it working. So the maintenance side of things. Then there's the connectivity issue that I've mentioned, and then there's at the other end, shall we say, in the city or the larger population centre, a commitment and a desire to actually make this work, to see it as important to support the care providers in the rural communities as the frontline providers of care, which of course behind that is that mindset issue that I mentioned, the assumption that what happens in the outside of the cities is second class. I think it's the bane of all of us in rural practice, a point of real frustration where the specialist just says, well, send us the patient, without any recognition that that might be hours or days of travel and a lot of logistic reasons why that's just not a practical option at all. So then, as I say, there are all these mindset issues, challenges that need to be addressed as well.
Okay, really pertinent comments. Amber or Dr. Bianca want to say something?
Yeah, I can add my 2 cents. I definitely agree with what Roger was saying about a lot of physicians in the urban setting treating rural as if it's second class. I mean, when I had to apply for my second foundation job, which will be in North Wales in a much more rural setting than I'm in now, all of my colleagues were just looking at me like, oh, is that what you wanted or did you end up there? And were quite surprised that I actually wanted to go rural. And I just posted a question on Twitter of, well, how do we change that mindset? Because, telemedicine, basically what I've observed is that the idea of introducing telemedicine has been mainly to help improve the urban setting of medicine. They're not really looking at it as a method for improving service and continued education in a rural setting, even though that's probably where it will have the greatest impact. It seems to be more like, well, of course it should be in the city because that's where everything else is. But actually, I think we should challenge that as healthcare professionals and say, well, why don't you try it in the rural area? Because you'll make a difference to you make a significant difference to a number of people instead of introducing it into an urban setting where everything already is. But that's certainly what I've been seeing, where people in rural areas are still slumming it the hard way, whereas in the urban setting they're trying all of these new technologies without considering the application outside of that setting.
Yeah, I can add some commentary actually. As I said before, I'm still in my graduation at my final year. So it's common to have some conversation with my colleagues. And when I talk about rural, some of them, they just don't have it as an option because they are too scary, because they are afraid of not having structure or not having some support from a hospital or any other health service. But nowadays, when I think about telehealth and telemedicine and all of this, I see this as a great support, and it makes me feel safe and encourage me to go to rural. And I just think to myself, maybe Roger can talk about his experience about it. Some years ago we didn't have it, and it should be much more tough to deal with the isolation. But today with the telehealth, we can be in touch at any moment, at any time. One of my internships, it was here in the rural area from Rio Grande do Sul, a place which Paola made a video so nice, Barão, the name of the city. And when I was doing this internship, we had a case of a woman, maybe 40s, and she had some problem issues with her joints, and they hurt, and we did all the possible investigation, and we had already I don't know how to say this in English, but we had sent her to the high complexity we had sent her to the rheumatologist, but she was waiting the list to they call her. And while she was waiting, we used the telehealth to try to make things faster. So when she got to the rheumatologist, she could have all the exams and everything that it would be possible to need. And some other patients we had discussed it to the telehealth, and I think it's amazing, absolutely amazing, and it's really nice. And I think that we have to use these arguments to try to bring more people to the rural, as Amber said. So I think it's a really amazing tool that we have.
Yes, nice people. Any other comments? We are going to the end of the discussion. So if you have any other comments, now it's the time to do. Okay. And
Yeah, we can conclude. Actually, we have discussed and we have shared a lot of from Roger and Joseph and others. Yes, uh, it could be definitely be helpful for the rural healthcare, but it can't be the replacement for uh, the direct care. But anyway, so as we see, we have seen lot of beneficiary and even telemonitoring and all in future and all more in wearables and from the home care. Lot of can be done from this telehealth. Actually, they are doing lot of care, home care from the wearables and all. We can expect more future new techniques, telemedical medicine part, but we have to accept and we have to um, uh, appreciate and accept the new techniques and all. This is good. And okay, it's time to close. I think 8:27. Yeah, it's 3 minutes more for then. Okay, thank you everyone. So, if any final comment from others.
Yeah,
Dr.
it's Roger here. Just to pick up on your last comments. First of all, I want to definitely thank you for setting up this discussion today. I think it is very important, and there are fantastic opportunities in the future with telehealth, and I think we've covered a lot of the main issues. In addition, there is the one that you just raised, and that is about using communication technology to support people's care at home. So telehome care in one form or another, and to support people not just when they're really sick, but maybe when they're in the recovery phase. So telerehabilitation, and there are good examples of this in different parts of the world, and again with great potential for the rural community setting. So I'd certainly encourage this group. I mean, I think the medical students and the young doctors in the rural who are practicing and will be practicing in rural areas are really the future. And I think this discussion has been really valuable in terms of understanding the potential and the opportunities and the challenges that we have to address to really to make the future of rural healthcare even better than it was, and one where we make the best use we can of the communication information technology to enhance the care of people that we have the privilege to serve in rural and remote communities.
Okay, thank you. Thank you, Dr. Roger, and thank you for everyone joining this discussion. It was really nice, and we're going to say goodbye and see you on next Road Cafe.
Yes, thank you for coordinating it, Andressa. I hope you enjoy it. I know that it's a little bit scary, but one step at a time. Thank you, Paola, for bringing your beautiful family to our discussion. Thank you, everyone, for your amazing comments. And it's really nice to compare the reality from different countries. And actually, all this conversation and all this discussion is telehealth. We are at this moment using it. So this is amazing. So thank you, everyone.
And our next Row Cafe, I guess it will be about, let me see here, mental health in rural. So
I love this subject.
so be prepared, and you are all invited. Okay.
Okay.
So that's all, people.
Okay.
Bye.
Thank you. Bye-bye.
Thank you.
Okay, thank you. Bye-bye.
Bye. Have a good weekend.
Bye-bye, everybody.
Bye, Roger. Thank you.
Thank you.
Bye,
Bye.
Gabe. Bye, Amber. Miss you.